It's 5:25 on Tuesday, August 23rd, 2022. I call this public meeting of the Kingsville Independent School District to order. Sorry for the delay. We had some technical difficulties. We'll have roll call. Joe Morellis. Here. Martine Chapa. David Garcia. Here. Elizabeth Ramos.
Here.
James Glusing.
Here.
Delma Salinas.
Here.
Brian Kufal is here. Let the record show there is a quorum of board members present. This meeting has been posted in accordance with Government Code Chapter 551, State of Texas Open Meetings Act. Kingsville ISD Board of Trustees will conduct a public meeting to discuss the following. A, discuss the proposed 2022-2023 fiscal budget. B, discuss the proposed 2022 tax rate. Are there any public comments?
No comments at this time.
Thank you. If not, I will turn the floor over to Dr. Pitts.
Thank you, President Kufal, Superintendent Dr. Pettis, members of the board. We have discussed the budget for the proposed budget for 2022-2023 in depth, but I'm going to give a short review here because this is a public meeting. After this meeting, the public will have an opportunity for comment on the budget. If you look at the very top, it has a tax rate. M&O tax rate is 0.998. The state compresses the tax rate every year based on property values. As property values rise, the state decreases the share, per maximum tax rate that can be charged by districts so that a community collects the same amount of taxes and isn't required to pay more as their property values rise. So essentially what happens is the state takes in more on their side as property values rise. The INS rate has risen to 0.5191. The total tax rate is stayed as 1.5189. That's what you see at the top. We're going to take a look at the general fund first, which is that first column going down. So if you look at the revenues, I'm going to talk about the main drivers for the revenues on the general fund. $9.457 million for general fund. And the main driver for that is our property taxes. We calculated a 96.7% collection rate. That is the lowest of the last 3 years. That is standard practice. So that leaves us a little bit of a cushion. If we could collect more than that, but that's being conservative with our budget based on best practice. There are other things that are included in that local revenues are gate shares at athletic events. Also interest that we collect on our investments. And then if you look at the biggest portion is the state revenue, and the state revenue is $16.68 million. The biggest driver of the state revenue is our ADA. So that is a projection based on 2,370 ADA. Last year, the budget was built on 2,688, and that turned out to be an over projection. We had thought that more students would be returning back after COVID, but because of some of the challenges, we only had 2,370 students show up every day this year, and that is what we budgeted for. So I believe that this is an accurate budget based exactly on what we had attendance for this year. So I am very, very confident of that number. It also includes our populations for special education, for CTE, early education, those extra dollars that we have for those populations. Federal program revenues mainly includes SHARS reimbursements, and we brought to you earlier a different SHARS provider approved by the board this year that we believe will be able to get us more reimbursements for Medicaid. Also in there are indirect costs from grants. Anytime you spend money on grants, the government gives you a portion back that you use for administrative costs to your general fund. So included in there are indirect costs from our title grants, also from our ESSER grants as well too. You can collect a higher, we have about 15% that we get back in indirect costs from our ESSER grants. That's the unrestricted rate. All the titles use a restricted rate, which is closer to 5.5% for our district. It's a rate that is determined by the state based on data that I submit during the year. Let me scroll down a little bit. So we're going to quickly review through all the functions. Again, I presented this before at board workshops and board meetings, but for the record, for the public meeting, I would like this to be explained again, so that way if there are any public comments that I provided them with all the information they need. So functional level instruction, that is anything that is for teachers and students. We're talking about teacher salaries and their paraprofessional salaries that are instructional aides as well too. There are about $2.7 million of instruction that are not included in our general fund that we have moved to ESSER 3 and ESSER 2 this year as well. So the actual amount that we're spending on instruction is several million dollars more than that. Instructional resources and media resources, again, that's salaries for technology and also all types of equipment that we purchase. However, this is also another big area that qualifies for the ESSER grant. So a lot of technology is in our ESSER grants. 13 professional development, again, a lot of that is included in our ESSER grants as well. Same thing with instructional leadership, that includes salaries of not only the executive directors at the campuses, at the administrative offices, but also we're talking about our literacy coaches, our math coaches, our CTE coordinators. So all of those salaries come out of function number 21, anything that has to do with instructional leadership. Again, a lot of those are in ESSER right now. School leadership, that all of our school leadership is taken out of the general fund. That's what it costs to not only pay for all of our campus administrators and also their front office staff, but also for all the supplies for the front office as well too. Guidance counseling, again, a lot of that is in ESSER. This also includes our diagnosticians as well to anybody that's involved in evaluation, as well as our counseling department. Social work services, the biggest part of that is paid out of ESSER, which is our Communities in Schools program. Health services, again, you see most of that is in ESSER because that's an allowable expenditure for ESSER. So that's why our local budget is very small for health services. Student transportation, that budget includes vehicle repairs, but we just purchased 3 more new buses, 78 passenger buses. Hopefully we won't need 78 students on a bus at any individual time. But so we believe that this year, with the way that we're doing our routes, we believe that we're gonna be more efficient and hopefully we'll have less breakdowns too, because we have some brand new buses. Food services, we'll talk about when we do the food service budget. Extracurricular activities, what was built in there was also the additional travel costs for mileage and the additional costs that the board approved for the meals as well too for our students. But a large part of that is, besides meals and mileage for our students, it's registration for all different types of athletic or other extracurricular activities, and then for all the supplies that they need to buy for those, including uniforms and actual balls or other athletic equipment that is needed. General administration, that is what is paid out of this administrative building minus all the instructional salaries and all the instructional expenditures, which are charged to function 21. Facilities maintenance, I did build into that budget for facilities repairs that are going to be needed based on the facilities assessment that is given to us in the fall. So in January, we will be bringing to the board the results of that facility assessment, and then there will be repairs that are prioritized that we're going to need to pay out of that function 51 for this next year. Also, a lot of the repairs, a lot of the improvements that are needed for security are building related. So all of those security costs are coming out of function 51, even though, again, function 52 is security and monitoring. Anything that has to actually do with building improvements is attributed to function 51. 52, that's another one where a lot of it qualifies for ESSER. So the majority of our salaries and our expenditures that are pure security in nature, not related to building, are coming out of ESSER. Data processing services, that is our district software. It's again around $300,000 for the software. We also have 2 salaries that come out of that function as well. Community services, most of our community services come out of Title I. There are a few things, for instance, there's on behalf that we have to pay the state that cannot, because it's required, come out of Title I. So that small part comes out of our budget for general fund for function 61. Debt services, we took out a loan 15 years ago for HVAC upgrades and improvements. This is the last year in February where we will pay our final bill. Again, as I mentioned at a previous meeting, we probably will be bringing another maintenance tax note to you in the fall, probably in the spring, where we take a look at all the results of the facility assessment, and we look at what we're going to need for HVAC upgrades. And then we're going to be probably bringing to the board another maintenance tax note, which basically is a loan on the M&O side. The reason why you can do that is because you get a guarantee that the amount of money you are saving in electricity costs is going to cover the cost of the note. So we would bring in our financial advisor to work through the logistics of that. So that's one that we don't anticipate decreasing in future years. But again, it will decrease our electricity costs. So overall, it will be a net increase to the district in funds, because you will see, once we get new HVAC equipment, you will see a decrease in electricity costs for our district. So it still will be a net gain for our district. You look at function 93, that is our agreement with the Texas Regional School for the Deaf. We have one student that is transported to Corpus, and then we have several that receive training here, and some students that receive some services remotely for that function 93. The last thing that you see there in the budget is function 00 transfer out. This we talked about is to food service. That is to cover our expected shortage in food service costs this year, and when we get to food service, I'll talk about the reasons why. So you look at our total expenditures, just over 28 million balanced budget with our revenues. Again, the reason why we're able to do that with right now is because we do have those extra ESSER funds. We will be talking about what we need to do to balance the budget next year when we have the ESSER cliff. We'll be talking about that when we bring to you what we are currently paying out of ESSER sometime in October or November. If you could scroll down to the last couple of lines. So we're anticipating a zero. We're anticipating breaking even. $0 that we're going to have excess, $0 that we're going to have a deficit, and a healthy fund balance of 8.9. For us, about 8.1 is healthy. So we were doing well now, but again, we're going to anticipate having to have several big infrastructure expenditures come in spring. We're going to move on to the food service budget, the second column. Food service, very little comes from local. That is basically what we sell for the ice creams or the pizza sales on Fridays. It's local revenue that students may purchase. All our students are given free lunches, free breakfast, free lunches, and free dinners, part of the community eligibility provision. But we also offer items for sale as well too, in addition to that. And that's a conservative estimate of what we are expecting to bring in from our local food sales. State revenue, that's very little that the state gives us for matching on some items. We get the majority of our revenue from the feds. And the way that we get that is we are reimbursed a certain amount for every breakfast, for every lunch, and for every dinner that we serve. That is where that money comes from. So if our students are not coming in the first place, then we cannot be reimbursed for that. If our students are not taking the lunch, we cannot be reimbursed for that. We just had a meeting today, Dr. Bess and I and I met with all the principals and with several key people on making sure we have a plan in place for our dinners to make sure that are taken care of for transportation, that they are taken care of as far as making sure that we maximize the potential for students who want to get dinner to get dinner. It's a win-win all the way around because not all schools offer dinners. And the way that we're able to do that legally and offer it at no charge to students is because we have after-school programs. So whenever we have those after-school programs, we are allowed to offer it not just to the students that are in those extracurricular programs, but to everybody in the school. So it's a win to the students because not all of them are always getting, 3 square at home. They're going to get 3 square here from us at KISD on the times where we are starting the dinners. The dinners are going to be started right away with the middle school and high school because their extracurricular activities are already starting, so we can legally give them free lunches. Once we start after school programs for the elementary schools, then we can offer it free of charge to the elementary schools as well too. So those are the drivers that determine our revenue, basically how many breakfasts, lunches, and dinners that we serve. So why are we projecting a deficit? Well, a couple of reasons. Before COVID, we actually had a surplus, but now we are serving less meals. And so that's one of the drivers is less meals served. And the other driver is they are drastically cutting how much they are reimbursing for every meal this next year. During the last 2 years, they gave a bump because of COVID. They said we're going to reimburse more for every breakfast and lunch, not for dinners. They didn't increase the dinners, but we're having about $1 a meal decrease in every breakfast and lunch this next year. So those are the biggest drivers: meals served, and now they are decreasing reimbursement rates. So we are hoping that the changes that we're putting in will have more dinners served, again, which will benefit the amount of students that get the meals, but also will benefit the district as well. So we're hoping to be able to decrease some of that $750,000 deficit in food service, but we are budgeting for it just to make sure that we are not caught at the end of the year with a deficit in food service. Could you scroll down, please? So their costs are mainly in food services. There are some facilities and maintenance operations costs because that is for our warehouse because they have to store the food and there's costs for the freezers and so on that come in that. But the majority of our costs are in actual, not only purchasing of all the food products, but then in the labor for that we have for our food service staff as well. If you look at the very bottom, then we are projecting $2.5 million in expenditures and a $36,000 deficit. That is after we transfer the $750,000 into from the general fund. But since we have a fund balance right now, again, we are still expected to, at the end of the year, have a fund balance of $55,000 at the end of the year. We're going to quickly look at the debt service fund. So the debt service fund, we're projecting $4.8 million in revenues. Biggest driver of that is our taxes that we collect, our local property value taxes. A portion of that goes to our INS fund. So we do have some state revenues. This may be the last year that we get any type of state revenues. So we'll need to raise probably $133,000 additional dollars next year because our projected bond payments will not decrease for about 11 years. Then the federal, we have two they're called QSCAB funds. We have reimbursements from the feds on 2 of our bond series. That should continue for the next at least 10 years. So you see our revenues projected at the top, 5.2 million. Scroll down to the bottom. So the $4.8 million is our actual payments and principal and interest, but as we already talked about with our cash defeasance, we are going to use the excess revenues to pay off some of our bonds. So that's what you see at the bottom. Even though we have a $1.5 million fund balance, once we pay our big bond payments in February, we're going to look at also using some of that fund balance, which at the advice of our financial advisor, what we can safely move to pay off some of our debts and still keep some in fund balance in case we have a low tax collection year. So now we're going to move to the tax rate, and then I'll open it up for public comment since it's a public meeting. So we're going to quickly put up that document. This is a notice that was posted in the newspaper. If you could increase the size of that a little bit so you can see it. And then we'll scroll down a little bit too. We are required to post this 10 days in the newspaper before the public meeting. We actually posted it 12 days before the public meeting. So if you scroll down, we're going to take a look at a couple of things. So the main thing I want you to keep going a little bit further. Okay, just a little bit more. Okay, perfect, right there. The main thing that I want you to see is that if you look at the decrease in taxes, the average homestead will have a decrease in $118.54 in taxes. The actual tax rate is staying exactly the same. The reason why there is a decrease in the average homestead, what they're paying in taxes, is because there was a Proposition 2 that was passed at the board elections Clayburgh County had their own item, the proposition to increase the exemption on the homestead from $25,000 to $40,000. So even though the tax rate stayed the same, they have more of their homestead that is shielded from actually paying taxes on it. So the average homestead will pay $118.54 less in taxes this next year. And at the same time, we are able to use excess collections to pay off some of our big debts. Again, we have over $51 million in debts right now that we're going to be paying out for at least the next 13 years. So at this time, I will, and again, the actual tax rate stays the same. The actual amount paid on a homestead decreases by $118.54. At this time, I'll open it up for any public comments. Yes, ma'am.
Okay, going back to page 9, which is the proposed budget. And if you go on the first column on the object code 61,
Yes.
and you said it's community services. And
Yes.
the bulk of that is paid out of Title 1, Title 2, whatever Title.
Yes, correct.
Okay, this is at 3,000 is above and beyond that. You can't pay out federal.
Right, there's certain things that you can't pay out of federal that they're basically on an employee's salary. You have benefits, but you also have on behalf services that are paid to TRS as well.
So my question is, community services, what does that mean? Or who falls under?
Oh,
community services?
okay. So our parent liaisons fall under community services, and then any of our services that we provide for parents that attend any of our meetings, that we try to have parent involvement meetings. So when we're buying refreshments for those meetings, that's also, or if we have supplies for activities that we have for those meetings. If we were in the past, before COVID, we actually took parents to a parent involvement conference as well too. So we actually pay that's an eligible expenditure as well too. So really it's basically parent involvement expenditures.
Oh, okay. I was just wondering if it's community service. Okay, that's my question.
Dr. Pitts, I have a quick question.
Yes, sir.
On the student transportation,
Yes,
was that based on the estimate from gas a couple of months ago when it was $5 a gallon, now it's $3.19?
that's a good question. That's based on estimates from our full fuel lease. So luckily we have a rate locked in. So it was based on what we were able to lock in earlier, which is very close to $3 a gallon. Luckily, we're able to do that before budget time, and the same thing with our electricity usage as well. We have our electricity usage locked in all the way till 2028. The fuel usage is only till December of 2023. So at that time, we will need to sign another fuel lease to make sure we lock in rates, but we always get a better deal than what the public has because we're part of a pool and we go through TASB and they're able to give us a better rate with more purchasing power.
Thanks.
Any further comments from the public? If not, I will declare this public meeting adjourned at 5:53 p.m. We will continue with the special meeting. It's 5:53 on Tuesday, August 23rd, 2022, and I call this special meeting of the Kingsville Independent School District to order. We'll have roll call. Joe Morellis.
Here.
Martin Chapa.
Here.
David Garcia.
Here.
Elizabeth Ramos.
Here.
James Glusing.
Here.
Delma Salinas.
Here.
And Brian Kufal is here. Let the record show that there is a quorum of board members present, and that this meeting has been posted in accordance with Government Code Chapter 551, State of Texas Open Meetings Act. We're now going to move to the moment of silence, followed by the Pledge of Allegiance and the Texas Pledge. Please allow me to extend the moment of silence a little bit tonight in memoriam of our immediately past president, Board President Colonel Stephen Kreitz. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor to the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one indivisible.
This meeting is being live video streamed at https://bit/ly/3srolqr. We move to item number 4, which is adoption of the agenda. Do I have a motion to adopt the agenda? So moved. Motion made by Mr. Morales. Second. Seconded by Mr. Chapa. All those in favor say aye. Any opposition? Motion carries unanimously. Item number 5, public participation. Do we have anyone that wishes to address the board?
Not at this time.
Thank you. Item number 6, communication from administration. 6A is a budget update report. This can be found on page 2 through 7 of our packet, which I believe is the check register. Dr. Pitts.
Thank you, Mr. Kufal. I'll just go over a couple of expenditures you see there. You see LN 100 LLC. We were given a grant that was administered through the service center of $35,000. We have made sure that we have used almost every last dollar of that, as close as we could get. So again, this is money that it was used to purchase AEDs and other nurse supplies, but this is money that does not come out of the general fund. It's a grant that does expire this year that will not, we will not be continuing in the future. You see that there's an annual fire alarm inspection and an annual fire sprinkler inspection. These are two different ones that we are required to have annually. So you see those costs there again, they are two different things. You also see Go Kits. We ordered more Go Kits for our classrooms. Those are basically first aid kits that are come in a little backpack that kids can carry with them. That I guess the teacher can carry with them as they have an evacuation from the school, or if there is a lockdown in the school, all of the supplies are needed in there as well too, including trash bags, so that they can make sure that they put it over the windows and make sure that we also have snacks and waters as well in the classrooms too. I will take any other questions that you have on the check register.
There being no further questions, we will move to item number 7, which is new business. 7A, discussion and possible action regarding the 2022-2023 Kingsville ISD proposed budget. Can be found on page 8 and 9 of our packet. Dr. Pitts.
Thank you, Mr. Kufal. You have seen the presentation in the public meeting. Administration is recommending that the budget is approved as presented.
You've heard the recommendation from the administration. Is there a motion to approve? Motion made by Mr. Chapa. Is there a second?
Second.
Ms. Ramos? Seconded by Ms. Ramos. Any further discussion? If not, all those in favor say aye. Any opposition? Motion carries 7-0. Item 7B, discussion and possible action regarding proposed 2022 tax rate and resolution. It's going to be found on page 10 through 12 of our packet. Dr. Pitts.
Thank you, Mr. Kufal. We are proposing that tax rate be levied of 1.5189 per $100 valuation. That includes a 0.9998 for M&O and a 0.5191 for INS. I'll talk about the language that needs to be done in approving or proposing the tax rate, and then when we're finished, we'll need to read the resolution. Mr. Maddox, those recommended actions at the bottom, do we need a separate vote on the M and O and a separate on the INS, or can we just put all those into one motion?
You can put all in one motion.
So administration recommends that the Board of Trustees approve the adoption of an M and O tax rate of 0.9998 per 100. Administration recommends that the Board of Trustees approve the adoption of an INS tax rate of 0.5191 per $100. Administration recommends that the Board of Trustees approve the property tax rate be increased by the adoption of a tax rate of 1.5189, which is effectively a 7.6% increase in the tax rate. Just want to clarify that effective tax rate is completely different than what they're going to pay. Effective tax rate means that since the rate stays the same and the property values increase, that effectively it would be an increase in taxes. But again, we know that that taxes are decreasing on homesteads by an average of $118.54. But that's again just a legalese term for the effective tax rate and a disclosure that we have to put when we are making that motion.
Well, board members, I move that the property tax rate be increased by the adoption of a tax rate of 1.518900, which is effectively a 7.68% increase in the tax rate. Is there a second?
I'll second.
Motion made by Mr. Kufal, seconded by Mr. Glusing. Any further discussion? If not, all those in favor say aye. Any opposition? Motion carries 7-0.
Mr. Maddox, could you read the resolution, please?
Sir. Resolution levying a tax rate from the Kingsville Independent School District for the tax year 2022. Be it resolved and ordered by the Board of Trustees of the Kingsville Independent School District on this date, be the Board of Trustees of the Kingsville Independent School District do hereby levy a set tax rate of $100 valuation for the district for the tax year 2022 as follows. 0.9998, wait, nope, sorry, 1.5189 for the purpose of maintaining operation for the purpose of interest and sinking debt service for that total tax rate. The tax assessor collector is hereby authorized to assess and collect the taxes of the Kingsville Independent School District, including the tax rate. The above resolution and order was passed by the Board of Trustees of the Kingsville Independent School District on this 23rd day of August 2022.
All right. Thank you, Dr. Pierce. We move now to item 7C, discussion and possible action regarding medical insurance, pharmacy benefits, RFP number 2223-001. It's going to be found on page 13 to 14 of our packet. Dr. Woods.
Thank you, Mr.
Thank you, Mr. Kufal. Going out for any RFP is a long, exhaustive process, especially so with one for health insurance. So about 3 months ago, the board approved for us to go out for an RFP for health insurance. And we then posted that proposal in both the Corpus Christi Caller Times and also in the Kingsville Record. After that, there is a period of about over a month where questions are asked and each provider has a chance to put together their proposal. Then after the proposals are submitted to us, then there is over a month-long process where we take to review all different aspects of the proposals. So I want to thank again Sandy Galindo and Phil Esquivel and another member of his team that wasn't here. We spent literally dozens of hours locked in my office, and including sometimes when the AC turned off late at night because someone's trying to save on electricity costs. But so again, we went, and I'm going to go through this rubric with you, but we spent many dozens of hours going through this and making sure that we are getting the best value for the district. Why did we go out for an RFP in the first place? Our claims are really good at about 2 million. Our service is good with both on the employee side and on the employer side. So why go out for an RFP? We owe it to our taxpayers. We owe it to our employees to make sure we are getting the best value for our employees. So That's why we went out for an RFP. And again, it is a lot of work, but we think that, again, it is worth the effort because we think that it is going to give us the best value for what we're putting into our health insurance. So let's go through the rubric. If you look at give us just a moment, we're going to put the rubric up there so everybody can see it. So we received 4 proposals. I'm going to talk about we've received one from the Ludicky agency that was fully funded. And even though we took a good solid look at that proposal, it did not meet our needs based for 3 major reasons. One was higher premiums. We don't want higher premiums for our employees. Number 2, the network was not as broad. And finally, number 3, it had higher deductibles too. So when you have a fully funded, you're locked in with the cost, but at the same time, you're not allowed to negotiate any savings. You don't get any rebates. We have been able to save money the last several years because we have had a self-funded plan, which allows you to capitalize on those interlocals that you have and on those rebates from and discounts from pharmacy as well too. So we're going to go through, and the other 3 providers we have were Blue Cross Blue Shield, Aetna, and 90-degree benefits. So if you look at line number 18, we're first going to look at total cost. So total cost was $3.3 million for Blue Cross Blue Shield, $2.56 million for Aetna, $2.73 million for 90-degree benefits. So what did this total cost include? Well, a big part of it is claims. Claims were about the same, well, almost exactly the same, $37 difference between Aetna and 90-degree benefits. The claims were quite a bit greater in Blue Cross Blue Shield. That's why part of their total price is higher. Other things that are included in that also include your fixed costs. Your fixed costs include your stop loss, and it also includes your administration fees as well, too. And then we went through those RFPs and we looked at all of the potential small fees that are in small print as well, too, to make sure that we had everything covered. And then there are also discounts that you have from pharmacy. So we took off all the discounts and also any allowances that you have as well, too, that you can use for basically your first bill that you have, or some of them are allowances on particular parts of your total package as well too. So that was the total price, and again, total price was cheapest with Aetna, and as you can see, the points that are awarded there for each one of those. The highest one gets the full points, and then there is a mathematical formula that is standard across industry average when you are comparing bids, that we use that same formula, so it calculates the others as basically a proportional percentage of where their price comes against the total price. So 50% of our final evaluation was the price. Then we looked at pharmacy. So when you're talking pharmacy, you're talking discounts, you're talking rebates, you're talking transaction fees. You're also talking about how much you pay for every individual script. So all of those are factored into that when you're determining pharmacy costs. Right now, when we looked at all the total costs, and again, our health benefits consultant had me run the numbers again and again, just to make sure we were double checking, to make sure everything was actually correct and we were taking everything into account. The lowest cost for pharmacy was again Aetna. So again, the highest percentage goes to that category, and then the others are a percentage of where their discounts, rebates, and performance guarantees fall in proportion to that. Finally, we also looked at network. When you're looking at network, you're looking at how many of your expenditures, how many of your claims are going to fall outside of the network. So we had every vendor that made a proposal to provide a disruption report, which shows that we give all of our claims, everything is redacted of all the confidential information, but all of our claims are run through their network, and we see how much our claims would be in the other networks and what percentage and proportion of the claims are out of the network. So when we looked at the different networks, again, that's how we compared them by that disruption report. So when you combine all of those together, you see the total ratings at the bottom. We are recommended, based on all the research again done by us and the health benefits consultant, that all of the information again on the rubric was posted what was going to be in the RFP. So this is what we are required to grade on. We're recommending that Aetna be approved for 2023. This would start at January 1. The reason why we bring it earlier in the year is because it takes a while to make sure that we are set up for next year. If we were doing a change to a different provider, we would need to get everything set up in their system, but also we have to go through the open enrollment process as well too. We typically go through that in November. This allows us to put together the benefit booklets for health insurance so that we can have them prepared for the open enrollment process. I will take any questions that the board has.
Dr. Pitts, thank you so much for the work that you and your staff did. We have our consultant here, Mr. Esquivel. Can you share a little bit about what you think about this process and maybe the selections that were?
Hey, number one, congratulations, passing standardized. Okay, congrats. So that's number one. Number two, hey, I just want y'all to know that we really did run the numbers pretty good. It was pretty thorough. And certainly I wanted to, thought it would turn out different, but because, there was some different added costs from different quotes and all, it pretty much wiped out any savings we're gonna have, and they broke even pretty much. And the way I see it is there's no reason to change it if the difference isn't $200,000 to $300,000 difference, because we can do the same savings if we implement the wellness program we're working on and the diabetes education program, because we have a lot of diabetics in the district, but between that will help us reduce claims. And by us reducing claims, we pay less out of pocket and we keep everyone at work. We don't gotta pay substitutes, it's just full circle. And so I had the honor to speak with a new HR, Dr. Holtz. Dr. Bettis connected me with her, and she's a really sharp woman, and she really understands about prevention and education when it comes to lowering medical bills, and that's health claims. And so, yeah, we're pretty thorough about it, and we spent a lot of time on it, and, Dr. Pitts and Sandy did a great job, and, there's a couple things, we need to keep an eye on, for example, just making sure that we tweak the plan a little bit, because the way it's designed right now, it's a lot harder for people to go to outpatient facilities versus the ER. So we got to change that up a little bit. So just little tweaks in the plan that I really think would help us out and make it a lot easier on the teachers. The other thing is the plans themselves, you know, they were comparable plans. And so Blue Cross Blue Shield, unfortunately, they're way out of pocket on the fixed cost. On the fixed cost, they were pretty close, each party. It was just when it came to the rebates and the pharmacies where you saw the bigger difference between the two parties. There was a $9.50 prescription charge that was added on that wasn't there last year, and it just blew them out of pocket, out of range, cost-wise for us to save money. So I think the best option is we stay with Aetna, we tweak it a little bit, we add the education program for the employees, and I think we'll have a better year this year in claims if we can implement that. So.
Phil, I have a question.
Yes,
And I know
ma'am.
you mentioned that you were gonna be working with like doctors in the area.
Yes.
Because some of them stopped taking patients.
Mhm.
And I know, like, say for instance, husband and wife. The wife was able to get in, but the husband wasn't, because he stopped taking patients, and it was like.
One's on Medicare and the other one isn't
Well,
on
no,
Medicare.
it wasn't even
No.
that. It was both just, school insurance. But I know there was one facility here that stopped taking patients. And so, and I know you're gonna
Yeah.
make sure that
Yeah,
hopefully is
Well,
taken care of to where they're actually gonna, there's no limit to patients.
we did have an OB situation that happened, but they straightened it up real quick with getting the doctor on the network. They finally negotiated the rate with him, but that was a tough situation. But if y'all hear of anything that we need to add the doctor onto the network or something like that, let us know, because we'll call Aetna and we'll get their team together to contract with the physician or the doctor, whoever it might,
And I know
the
it's a good
hospital.
thing for that doctor, because he's overloaded, he's got a lot of patients.
Yeah.
That speaks highly. But it's an inconvenience for the family. One has to, they're accepting that one, but when the husband went, they weren't taking any new patients. I just thought, maybe. And I can talk to you about it.
But I'll handle those situations and turn the fire
That
out.
didn't happen.
Well, those are situations where those need one-on-one, and we can get that resolved one way or another. But Don, what was the renewal rate? Were they gonna go up on us 3%, or did they, say no? 3%
What are
on the renewal?
you talking about for stop loss?
No, yeah. What would they were gonna charge us an increase, right?
Well, and as far as stop loss, there was a slight increase in total stop loss, but with their best and final, they also came down a little bit.
How much was it, 3%? What was the rate y'all came down for us? So the final offer is what? Yeah. Because you will be approving it with a rate increase, so I'm seeing.
Okay, so just to clarify, every year, fixed costs go up a little bit. And that's with the rising healthcare costs. So, but again, that's factored into the total cost. So you see the total cost there for each vendor that is factored in there. But as Mr. Escobar stated, we believe that with tweaks to the network that we can actually decrease claims. And there's a good chance that our total cost could be actually less next year. Yes.
Any other questions?
What I appreciate about this process is just a couple of years ago, we really didn't have somebody kind of advocating and fighting for everything that we needed, so, our whole, Ms. Galindo, Dr. Pitts, Mr. Esquivel, and then your associate. They did really spend hours and hours and hours hashing out through all of this. And so questions like this, what Ms. Salinas had, I think We just need to encourage our staff to approach us about it, because he'll go check.
And I know you will, I mean,
Yeah.
I know you will.
As Dr. Pettis said years ago, we just had an outside consultant that we just trusted to do the whole process, and we weren't involved at all in it. And to be honest, they were charging a lot of fees. A couple of years ago, Sandy and myself, and we brought on Phil Esquivel, we started really diving into it all by ourselves to make sure that we eliminated any extra added cost or agent fees for our health insurance, and that we were getting the best value for our district. So what the administration recommends, the Board of Trustees approve Aetna for the 2023 medical insurance pharmacy benefits RFP number 22-23-001.
Before we do that, I got a question. We have Mr. Esquivel on contract, is that correct?
He is currently on contract till September the 30th of this year of 2022.
That's next month.
Yes, that is correct. But let me add that according to his contract, it says that he has, it was for 1 year, but a optional 3 one-year renewals as part of that original contract.
Thank you, Dr.
All right, you've heard the recommendation from administration. Is there a motion to approve the request? Motion made by Mr. Chapa, seconded by Mr. Garcia. Any further discussion? If not, all those in favor say aye. Any opposition? Motion carries 7-0. Item 7D, discussion and possible action regarding COVID-19 leave during the epidemic resolution. This can be found on page 15 and 16 of our packet. Dr. Pitts.
Thank you, Mr. Gufall. We brought this last week to the board, and the board asked us to make a couple of tweaks, so we are bringing it back. This resolution would be retroactively providing a maximum of 5 days of COVID leave from July the 1st. We would continue that all the way till January the 17th. That is the date of a board meeting, so we would have a chance to, at that board meeting, extend it if we wish to. So if you look at the language, and hopefully Mr. Maddox will be kind enough to read the resolution later if the board approves it, but the language that we included in there was employee must provide a lab-confirmed COVID-19 positive test for themselves or medical certification of a lab-confirmed COVID positive test for a dependent in their household as described under IRS rules and regulations. COVID leave will only be granted if the district determines that the employee or dependent needs to be quarantined as per CDC guidelines in effect at the time the leave is requested. So one thing also that's added is in there is if the dependent is quarantined, then this also allows the board authorizes the board to have provide COVID leave for somebody whose dependent is quarantined because of COVID. So for instance, if a student had to stay home because of COVID and the parent wanted to stay home, we could grant them leave. We now, according to CDC guidelines, we would not quarantine the parent because according to CDC guidelines now, close contacts are not required to be quarantined if they do not experience symptoms. So even though the parent wouldn't be required to be quarantined and stay at home, they still could opt to choose to stay home and have up to 5 days of COVID leave for a dependent that is living in their household that does have a lab confirmed positive case of COVID. So I'll take any questions that you have at this time.
On the lab confirmed test, and now is that something that they go to that's a they're a certified lab, but is it a 1 day, 15, 20 minute like they have? Or is this gonna be something that sometimes takes 24 hours, 36 hours?
It could be something as simple as CVS or also Walgreens that have those tests that are free of charge to anyone. And usually you just schedule online an appointment and go right in free of charge. And so all of our employees could get that.
But
It's
those
not
are
that
not
easy.
confirmed lab, those are not lab confirmed, those are like rapid. Lab confirmed to me is a PCR, and the PCR takes at least 24 hours, or it might take longer depending on when that sample went to the lab. That's a lab confirmed. The rapid is not a lab confirmed.
Let me defer to Sandy. Walgreens and CVS, I thought that they offered both rapid and they also offered the PCR.
Well, they consider it lab confirmed. It's not the home test. So the lab confirmed, because they say that they have two types of tests, and I've done them personally. If you go to Castaneda, they do the rapid test, which you get, within 15 or 20 minutes. But it is considered a lab confirmed because of the process they use. That is the verbiage that they have indicated on the. So it's anything but something official that is not at home, an actual.
If you read up on it, because I did, and a lab confirmed is when the actual sample is sent off to a lab. The other ones are either you can have a rapid, you go to CVS, it can be, that's a rapid test, it can be an at-home test, or it can be an over-the-counter test. Those are rapid. Those are not lab confirmed, because they're not sent off to a lab. And I went to Castaneda, because I had COVID. And they do not test you. They do not offer to test you if you tell them you have COVID. And that happened to me. So I don't know. I just have a problem with that.
The reason why this language was originally added there is because we did have employees, unfortunately, that were taking advantage of COVID leave. And
I can see that, but now it's just 5 days. So if they wish to, and I hate to say lie about it, well then, they're risking using their 5 days, because what if they get really sick? Another time, they're not gonna be given another 5 days, right? Or is it just
If we
5
don't-
days per incident?
no, it's 5 days for the whole period, but if we don't require any certification, then that allows them to just say that I took a home test and I was positive and I'm staying home, and they don't have to provide it.
But I thought the charge nurse had a lot to do with this. I thought, they would call the charge nurse and, like, I know, for instance, in speaking to Dr. Bettis last week, if the nurse determines that a person is sick and needs to go home, she can do that.
That is correct. So there's a couple of things. One is whether they've been tested and have a test, and the two is whether they actually have symptoms. And we believe this language, it says,
The last sentence.
the last sentence says that if the district determines that an employer or dependent needs to be quarantined, then we are granting leave as well here, unless I think that the danger of not of just allowing anybody to just say that they've taken a home test and just provide that, it's very difficult, because even if we required them to provide documentation of a home test, there's no guarantee that it's actually them.
But then that's what they're gonna, the price they're gonna pay later on, because what if, and you know what, sir? If they want to beat the system, they're gonna beat the system anyway. But I think limiting it to 5 days, you need, as an employee, you need to be very careful and intentional as to how you use those. And if the government, that's the purpose of sending these home tests, because the government believes that that'll help the spread of COVID.
Well, those home tests can be highly inaccurate considering how they're handled, how they're stored, and how they're being tested. There's no,
Well, I think
other
any
than
test
people
can
reading
be
complicated
false.
instructions from China. I think the issue here that I'm seeing on this page is that it says the authority granted by this resolution allows a maximum of 5 days of paid leave per employee beginning July 1st through January 17th. So that means they get 5 free days of COVID leave up until January. So come January, when this comes back to us and we decide to renew it, and they might be expecting another 5 free days. So I would hope that maybe we can change this and state there it's 5 days for the entire school year, not from
And
July
then also-
1st to January 17th.
This one starts, you're gonna retro to July 1st. I know the last resolution expired on March the 31st.
Yes.
So on April 1st till the end of the school year, people were not covered. So I think in order to be, and I don't even know if anybody had COVID at that time, but if we did have any, I think it should go back to where, we should go back to April the 1st, just to ensure that, and give everyone a fair chance to be covered.
Leave,
Because there was a period in time that nobody was covered.
that is true. Leave is given, there are 5 days of personal leave and 5 days of sick leave that are given every year. And the start of that calendar year is July the 1st. So all of those days in April and May, that's back from the previous year with leave from the previous year. So we're recommending going back to the earliest possible start of this year with leave, starting on July the 1st. That gives everyone the same fair shake this year with their leave for this year, with their 5 personal and their 5 sick leave.
But what if we had people that were sick last year? We're not gonna go back and honor those days?
No.
How many teachers have taken off COVID leave this month?
Say that again?
How many staff members have taken off COVID leave this month? And are using their sick pay?
I don't have the answers to that. Do you have any information, Dr. Holm? So we haven't, but you're right, we haven't provided sick leave since the last resolution. The reason why it has been brought to the board now is because when there's more cases in the community, that's when we brought it here. When there were decreased cases, it wasn't determined by the board. The board had made a determination at that time based on the cases not to renew it. So we brought it to the board with the option to renew, and that was the determination that was made at that time. But
No, we take it to the back.
I don't even think it came to us.
What?
We chose not to
I
renew.
just think it expired.
It expired.
But it expired and no one brought it back.
So nobody brought it back.
Was it brought back? You're saying it was brought back, because I'm trying to recall too. Brought back in April?
I don't recall bringing it back.
I don't recall bringing it back, but we can find out. Let's go back and look at the word book.
All right, part of my issue is I lab confirmed, not lab confirmed. It comes down to a trust issue, but it needs to be very clear that if we require lab confirmed, then that be from this day forward. Anyone in the last couple of weeks that did not have lab confirmed, we didn't have a policy requiring that. So if we're gonna retro this back to July, then in essence, we're changing the rules on what has already happened in the past.
our previous resolution that expired, we already included that language in it, lab confirmed.
I disagree. I looked at it this morning.
You have a copy of it?
We'll try to get it.
Elena, can you look it up?
It was done in December 14th, 2021. I can pull it up here in just a second. There are two things that were added. The words lab confirmed, and the others was the sentence dealing with COVID-19 leave will only be granted if the district determines that one sentence, and then obviously the dates were changed. My other question is, COVID-19 leave will only be granted if the district determines. Who's that person?
The nurse with HR, because if our nurse sees an employee, for example, today, that had symptoms, and the nurse believes, according to their own medical experience, that they should go home and quarantine and go take a test. So maybe they don't take a test until the next day, and then they don't get the results until the following day. Those are 3 days right there that could be used for COVID leave, even though they don't have that lab confirmed test result yet. But we're quarantining them based on our medical expert, which in our case would be our charge nurse and our nurses. So that when I read that language, that kind of allows some flexibility if they're not gonna get, because again, they're being sent home on one day, they're going to take the test, maybe they don't get the results, so that could be 2 to 3 days.
because we've sent them, I believe that we should offer, I recommend that we should offer them COVID leave. And again, it's up to 5 days, but that's, either we eliminate the word lab confirmed, perhaps put clinic. Mr. Maddox, do you have some recommendations?
Hang on, almost to the
Continually
policy.
changing.
The policy that we had last year said, and this was December the 14th, so this was the last one that was enacted. Now therefore be it resolved that the Board of Trustees of Kingsville Independent School District authorizes providing additional paid leave for all regular employees, contractual and non-contractual, salaried and non-salaried, who are sick as a result of an epidemic. Employees must provide a COVID positive test result for themselves or medical certification of a COVID positive test result for a dependent. So it didn't specify lab confirmed or not. It was a,
Company or business confirmed, would that be more specific? Does that just take out home test?
here's my deal, and I know from personal experience that I've had employees in this situation. If they take if a person has symptoms and they take a home test and it comes back negative, that person still needs to stay home if they have symptoms. If that person has symptoms and they take a home test and it comes back positive and they go to the doctor or Castaneda or somewhere, they will not retest them. And so that person, either way, is not gonna have a lab confirmed. And to me, the bigger issue is, and I think what CDC has been moving toward, and that's why I've asked that language be in there in terms of CD, because they're changing all the time. The big issue to me is the symptoms. If you're ill, stay home.
I think maybe what's probably on our mind is that, how do we know they're telling the truth or not? So could we, as a district, maybe our charge nurse, administer the tests of someone who is showing symptoms? We would have that documented as being a positive test, and therefore we could send them home without the fear. Are they really sick?
You're just exposing the weak first.
It's no different than.
Oh, yes, yeah, regardless, she's gonna, or he's gonna be,
And David, I was sick and I had, I tested positive, whatever. I went to the doctor. He didn't test me. He didn't let me in his office. He came to my car and took my vitals there with gloves and all this stuff.
Mhm.
So do you think it's fair to us to send Delma to the nurse to get her checked when she's sick? It's like, we're just spreading it more, I think. I mean, that
Several
was
years ago, we had a calendar designed specifically for a holiday the day after the Super Bowl, because that's when we have lots of employees calling in sick. We know they do, we know they're going to. And we don't take the school bus around to their house and call them liars. I think if we operate in good faith from a point of trust, this is not something that's gonna be written in stone forever and ever, we hope. We hope that it goes away at some point, hopefully by January the 17th. But so lab confirmed, not confirmed. I'm fine with the language that we had in the previous one that just said a positive test result.
Let's provide a COVID-19 positive test result. And remove the word lab confirmed. And I'm fine with that too.
Then we would also remove lab confirmed from the second part of that says for a dependent as well.
And one more clarification. In your scenario, and I agree with you, that if I have a child that I can't take to daycare, and perhaps I come up with a day where I just don't have them covered, and I need to be home with him. then that could be covered under this COVID leave because it's an independent. If I only need one day, if I have 5 children, can I use that one day 5 times?
Can you use one day 5 times as long as you don't go over the 5?
Within my 5.
Yes, yeah, yes, that's what we've done in the past. The other thing is, we probably remove the language for medical certification of a lab confirmed COVID positive test result. We just put COVID positive test result in both places.
That does mean, let's say in that scenario, we have somebody who's out for 5 different children, 5 different times, 25 days of some,
No, one
No,
day.
one-
Okay.
only need it to be.
1 day. Okay.
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 So everyone just gets 5 days regardless, right?
Is that for the school year, or is that up
until
January
January
17th, and then it renews again for another 5 years if we decide?
It
or
depends on-
5 days if we decide.
That's when we would bring it back, and then you all would determine that too.
Yeah.
I think that's where the frequent flyers is coming in.
I'm really inclined to limit it to 5 in the school year. However, if we write that into this resolution, it implies that we're going to renew it automatically in January. And this leaves us with the ability to not renew it like we did in April if it came back or just if it didn't come back.
Just say per school year.
Why January 17th?
It's the board meeting.
After the holidays.
So do you think it's better just to do it for the whole year and just cover it all now, and not have to come back in January? At that time, it may be on the box.
Well, like Mr. Copel said, we want to go back to July 1st. Is there, am I assuming that there's people that want to get their days back?
Yes.
Okay.
Can't you just put per paid leave per employee each school year expiring January 17th, 2023? Each school year?
So we have to put an expiration date on this.
We do not, we have, so that we force ourselves to revisit it.
I agree with what was being said. Why make it December the 17th? Why don't we make it for the whole school year, just 5 days?
5 days. the whole year.
Because what happens if a cure for COVID comes out next month? And it's no longer necessary for anybody to be quarantined or isolated. And in April and May, we've got people that say, I've got COVID. And suddenly they've got new things that say, we don't have to do this anymore.
Can you put verbiage in it that says that it may expire at any time during the school year, depending on
The purpose of this.
environmental circumstances? Who knows?
The purpose of this resolution is COVID leave during an epidemic. That's what it says at the very top. So if there aren't cases in the community, it's very hard to say that we have an epidemic at that time. I mean, you can always say till the end of the year or to the end of 2 years from now, but we think that by January 17th, we'll be able to reevaluate the system and see if there still is an epidemic and if we need to continue it. I believe that, correct me if I'm wrong, Mr. Maddox, if we decide to January 17th, extend the resolution for a couple months or at the end of the year, that doesn't mean that we have to add extra days to the 5 days that we already have. We could keep those 5 days and people that haven't used their 5 days could get days for additional months.
That's correct. We just extend this. And also the authority of this resolution is the epidemic status of COVID. So otherwise, we'd just be adjusting our standard leave policy.
So we remove lab confirmed and make a recommendation.
Or not certification.
We had that in the last one. I don't know why is for themselves or medical certification of a COVID positive test result for a dependent in their household. And I guess the reason for that was not letting the kid get away with a home test. The kid had to get a real test.
If my memory serves correctly, it was that's a little bit different than what we actually voted on. There was supposed to be nothing approved that wasn't an outside lab test. You couldn't take a home test at home and bring it in. We've been through this. And I'm open for however it's decided, but I don't think that it was written and recorded the way it was voted, because we did have that conversation.
I'm
Right.
reading from the December resolution.
That's what I'm saying, is I don't believe it was recorded properly, because I remember the conversation. But we can go either way. I think it's sound advice, either way.
Were they even passing out the free test? Yeah, because right now you can go online and order another 8.
Can we recommend that we just remove lab confirmed and medical certification, just stick with COVID positive test result? Honest people will be honest. If someone trying to circumvent the system, so be it. But we will have done our due diligence to support our employees.
But they know it's only 5 days for the whole school year.
5 days for the
So
whole.
if you've used it
school year.
and you lied, well, then too bad you don't have any more if you get sick.
Yeah, but
It's
in
on
the
you.
contract, it says January 17th, it doesn't say the whole year.
And I think it's a January 17th because of the epidemic status that allows us to be able to do this. So if we do come back to January 17th, exactly what Mr. Kupal said was, or somebody said, we don't have to extend the number of days. We can just say it can continue because the epidemic is still evident.
Yes. So we can exclude those who've already had their 5 days?
Well, you're not replenishing their days. So we're just continuing this resolve.
Board, I recommend that we approve this resolution with the amendments just enumerated by the superintendent, that being remove lab confirmed, remove medical certification, and that the remainder of the resolutions stand. Second.
Second.
All right, there's been a motion made by Mr. Kufal, seconded by Mr. Garcia. Any further discussion? All those in favor say aye.
Aye.
Those opposed? Motion carries 7-0.
Mr. Mannix, could you read the resolution, please?
Yes, sir. I'm going to slow down the resolution section so that we have it for clarity of record, because we may change this to the written document. So resolution of the board regarding COVID-19 leave during an epidemic, whereas the board is authorized in education code section 45.105 to extend funds in Kingsland to the school district for purposes necessary in conduct of public schools determined by the board, whereas the board acknowledges that during an epidemic, district employees may be instructed not to report to work after on-site exposure, whereas the board finds that a need exists to address additional leave in circumstances of an epidemic, whereas the board concludes that providing additional paid leave to all regular employees, contractual, non-contractual, salary, non-salary, who are sick or in isolation as a result of the epidemic, serves the public purpose of protecting students and staff and maintaining morale and reducing turnover. Now, therefore, be it resolved, the Board of Trustees of Kingsville Independent School District authorizes providing additional paid leave for all regular employees, contractual and non-contractual, salaried and non-salaried, who are sick as a result of an epidemic. Employee must provide a COVID-19 positive test result for themselves, or a COVID positive test result for a dependent in their household as described under IRS rules and guidelines. COVID-19 leave will only be granted if the district determines that the employee or dependent needs to be quarantined as per CDC guidelines in effect at the time leave is requested. This authority granted by the resolution allows a maximum of 5 days of paid leave per employee beginning July 1st, 2022 through January 17th, 2023, as described in the American Rescue Plan Act of 2021. This extended leave is temporary to address the current emergency situation and expires on January 18th, 2023. This day, 23rd August, 2022, by the Board of Trustees. Board, did that accurately reflect your changes in the resolution?
Yes. All right, we move now to item 7E, discussion and possible action regarding the 2022-2023 memorandum of understanding between Kingsville ISD and Education to Employment Partners. We found page 17 to 23 of our packet. Dr. Settle.
Thank you, Board President, Mr. Kufal, Board of Trustees. I'm here to present our MOU between Education to Employment and Kingsville ISD. We brought this last week to the board. There were some discussions, there was a vote. It was turned down. After that vote, we were asked to go back to the drawing board, revisit the MOU and make it a little bit more KISD friendly. There were some revisions that were made to the MOU. I think it was over 18 revisions that were made. Most of them were added in the section of the E2U, let me go back, E2E shall, and there was like 16 different ones added to that that are going to benefit the district in terms of specificity on what specifically they're doing for the district in return for the money that we've invested in the program. Some specific things that they've added in the KISD shall. Number 2, they specifically added Dr. Juan Sotomayor will oversee the program. The other thing that they've added in number 3 is the other high school counselors are routinely invited to. So that was added specific to it. Some of the other things that were also added to B, the E2E shall. Number 2, they are going to present to the Board of Trustees some of their findings in terms of the results of the program. They are going to provide additional post-secondary enrollment data and reporting for recently graduated students in 2023. Number 5, that was added. Number 6 was added. Number 8, 9, 10, 11, and 12, 13, and 14 were also included in this new MOU. Specifically added in this MOU was that we were going to be providing these services to our juniors and seniors. That was one of the things that the board had specifically addressed in the last conversation we had. So all in all, this MOU, I think reflects the vision of the board, and we recommend that the board consider approving this tonight.
Heard the recommendation of administration. Is there a motion to approve? Motion made by Mr. Garcia. Is there a second? Seconded by Ms. Salinas. Any further discussion?
For calendar purposes, when would they come and make a presentation or at least give information in their workbook findings?
I would recommend November would be the first one.
And the second one would probably be like summertime, right?
Well, it says in here, such presentation presents to the board data, the extent to which it utilizes and generated results. It says such presentation must at least in board meetings in January 2023 and immediately prior to any district graduation occurring.
And that is.
All right, no further questions. All those in favor say aye.
Aye.
Any opposition? Motion carries 7-0. 7F, discussion and possible action regarding Coastal Bend College, CBC, dual enrollment MOU for 2022-2023. It's going to be found on page 24 to 67 of our packet. Dr. Pitts.
I'll go ahead and do this presentation. If you have any questions, Dr. Pitts may be able to answer some of those if I can't answer them for you. Before you have 2 dual enrollment MOUs between Coastal Bend College and Kingsville ISD. We do have 2 MOUs because we do have 2 different programs that we serve at HM King, one of them being the early college high school, the other being our dual enrollment students. The contracts are basically the same. There are some small differences in the 2 contracts or MOUs. One of them being course load in our early college high school. It begins the fall of 9th grade year. Students can start taking courses. There are some prerequisites that they're required to take during the summer bridge for students that are enrolled in early college and high school. Dual credit students can only start taking courses their spring semester 9th grade year. But there are still the same requirements in terms of TSI prior to taking any courses. The other difference in the contract is course sequence. Early college high school students are able to take up to 90 hours, or let me go back, up to 60 hours in their coursework. The students doing dual enrollment can take up to 60 hours as well, but they also have the opportunity to take additional courses that are more aligned with the CTE courses that are also being offered at CBC. So in essence, these contracts are very similar, just those 2 different things that I wanted to point out to you that's different than 2 MOUs. I'll take any questions at this time.
There's no questions. You've heard that the administration is recommending that the MOUs be approved as presented. Is there a motion to that effect?
So moved.
Motion made by Ms. Ramos, seconded by Ms. Salinas. Any further discussion? If not, all those in favor say aye. Any opposition? Motion carries 7-0. 7G.
Thank you.
Discussion and possible action regarding employee compensation and premium pay during periods of closure and non-workday resolution. It's going to be found on page 68 to 70 of our packet. Dr. Pitts.
Thank you, Mr. Gufel. The board is required to pass a resolution whenever they authorize pay for employees that are not performing their duties. This is to avoid a gift of public funds. We have brought this for the last couple of years to the board because of COVID. We started off where when the district was closed because of a lot of COVID cases, we didn't want to penalize employees' salaries and their hourly pay when they were sent home or when the district was closed because of COVID. But again, the board had to pass a resolution at that time to pay employees when they were not actually working. This has been extended to also include bad weather days, because sometimes the district is closed whenever there's a freeze and or power's out or water's out and we don't have electricity at the schools for some reasons. Also, whenever there's another local emergency, added to this resolution that's different is also early release days, employee morale, employee retention. So after consultation with legal, there are often days during the year, such as before Christmas or before a holiday, where students have an early release. So because of that, we're also wanting employees to leave a little bit early on days before holiday. But again, at recommendation of legal, we just figured we'd add that language in here to make sure we're covered for all possible scenarios. I will take any questions that you have.
Just a quick question. So this, give me an example of, for example, bad weather day or a snow day.
Right.
We've had to do it when there's a flood.
We had that freak ice storm,
Oh, that's
a couple, either last year or last before.
So this is what we're talking about.
Yeah,
Okay.
and it's
An
the 4:30 in the morning robocall that says we're not having school today.
No way.
I watch Channel 3.
So it's like the people that are hourly?
Yeah, okay, pretty well.
Well, this affects, right, it affects all employees to pay them when they're not working, but when the district is closed.
Oh, okay.
And we usually also base those things on instructional minutes as well, because we have that in our calendar, where we have a certain amount of days extra, so it's not hurting the students when we do that.
Well, I guess what I didn't make myself clear is, you have weather days already factored into the calendar, right?
Yes.
So this is just an extra emergency that's not factored in the calendar?
So there's two parts of it. One is students need to have a certain number of minutes. Is it 75,600 minutes? 76,500? Okay, well, one of those. So because otherwise we lose funding if we do not have that many minutes. So we built in days last year into our calendar because of a couple of things. We were able to use those for not only COVID when they came back from Christmas, but a couple of bad weather days. And then also when we had that that scare because of the Uvalde incident at the end of school too. So that allows us to still have the required number of minutes and not lose funding for those days, because otherwise we lose funding if we drop under the 75,600 minutes. So that's one thing. Students have their certain number of minutes, but then the board approves a budget that has a certain number of calendar days for each employee. And so if for some reason employees are not working all of the days on their calendar so that we do not have a gift of public funds, the board has to approve a resolution to pay employees essentially when they're not working. So it is not considered a gift of public funds.
Thank you.
I read the Farmer's Almanac, and it's going to be a winter, it's gonna snow in Texas.
Really?
Dr. Pitts, what happens, just, I think before summer, we had a church burn near one of our schools. If had it gotten worse, okay, and the school had to be evacuated, that particular school,
Yes.
teachers, students, what happens? This will cover those teachers, is that correct?
It does have other local emergencies in here built into this resolution, so I believe, Mr. Maddox, would you?
Yes, sir, it's 1, 2, 3, it's the fifth whereas.
I'm thinking because, well, why were they off and we weren't off? You know what I'm saying? Where we could come across that, that's what I'm afraid of.
Are we?
Oh, you're talking about,
Just one school going down, not all. Like, you know.
we would, yeah,
Gas.
depending on what the situation is, I mean, at some point, we might be able to relocate students and the teachers and staff into the different campuses. We could use Clayburgh, part of Clayburgh, we could use, so that, yeah, to be safe, to make sure that we're being fair for everybody, because yes, we would get that, why are they off and we're not? Yes.
Can they go home and teach like through COVID? Or do we have to come for resolution?
We wouldn't be able to do asynchronous learning with asynchronous. We wouldn't be able to do that.
We'd have to have permission for that.
Don't we also now have to have a certification for the asynchronous learning?
Yeah, I mean, I don't think that's an option.
Any further questions? If not, you've heard the administration's recommendation that the policy and resolution be approved as presented. Is there a motion to that effect?
So moved.
Motion made by Ms. Ramos. Second.
Oh, you still.
Is there a second? Seconded by Mr. Morales. With no further discussion, all those in favor say aye.
Aye.
Any opposition? Motion carries 7-0.
Mr. Maddox?
It's a long one too. All right. Resolution of the Kingsland Independent School District Board of Trustees regarding employee compensation during periods of school closure and granting superintendent service related to employee duty days and compensation. Whoever wrote this, I really like using their words. Whereas the state and local officials have determined that a state of emergency exists in Texas due to public health risks posed by COVID-19 and other local emergencies, emergency retention, employee morale, and employee release days, and whereas the recent COVID-19 outbreak and inclement weather have resulted in the closure of schools statewide reasonably anticipated to interfere with the regular operation of schools within the Kingsland Independent School District in the coming weeks and months, and whereas the Kingsland Independent School District administrators continue to respond on a daily basis to recommendations and guidance related to public health and safety from national, state, educational, and public health officials during rapidly developing situation, and whereas Kingsland Independent School District may be required to close the schools from time to time to protect the public health and safety, the Board of Trustees finds that the public purpose exists for compensating Kingsland Independent School District employees for lost work during periods of school closure due to COVID-19 outbreak and weather, and or local emergencies, employee retention, employee morale, employee early release days, and whereas the superintendent of schools requires authority to modify the school calendar and employee work and duty days necessary to respond to educational needs of the student during rapidly changing circumstances posed by these local emergencies, employee retention, employee morale, employee early release days, and whereas this resolution is not meant to excuse the failure to report to duty on these days by any employee who was instructed by the administration to do so, or who are required by contract or job description to report for duty, and who are emergency service personnel or whose presence is necessary to provide for the safety and well-being of the general public, and whereas Kingsland Independent School District Board policy to be a local includes provisions for paying employees who are prevented from working during emergency closure. Now therefore be resolved by the Kingsland Independent School District Board of Trustees that all the above recitals are adopted and finding of fact and are incorporated into and made part of this resolution for all purposes. The superintendent of schools is granted authority to alter the school calendar as necessary to accommodate the instructional needs of students, public health and safety recommendations from the state, local public health officials, and, oh my goodness, the facilities needed in the district. The board determines that pursuant to the work calendar developed by the district superintendent of schools, regular work days missed due to school closure during this COVID-19 outbreak, weather, other local emergencies, employee retention, employee morale, employee early release days may be potentially may not be made up by Kingsland Independent School District employees through either additional days of instruction for students' performance or their additional duties. To the extent that Kingsland Independent School District schools are closed by administrative or board action, such closure results in the loss of paid employees of the district who are prevented from working due to school closures. Employees will be paid in accordance with each employee's regular paid rate for the employee's regular duty schedule, which falls within the period of school closure, and for which the superintendent has instructed the employees to refrain from work. The board finds the payment to employees for lost work days are necessary for the conduct of public schools in so much as such payment allows Kingsville Independent School District to retain critical staff during a period of public health emergency, retain key employees necessary for reopening schools, prepare for resumed school operations after school closure, and to deliver instructions to the students of the district using alternative methodologies as may be required. The board further finds that a public purpose is served by making such payments and authorizes superintendent of schools to implement a work schedule that includes paid leave due to school closure. The board further authorizes superintendent of schools discussion to designate an additional duty pay schedule that permits the payment of additional wages and non-exempt employees who are required to work during emergency closure in accordance with board policy DEA local. This resolution extends the expired resolution to June 30, 2023, approved this 23rd day of August 2022.
All right, we move now to item 7H, discussion regarding board policy CH local. This is a discussion item only. I gave each one of you a handout that has on the front page a copy of our CH local. You then have 7 or 8 pages following that, which is the handout for several districts in our area. The purchasing authority section generally has an amount in there that it limits what the superintendent is allowed to spend money on prior to getting board approval. For some reason, we have an extra paragraph that frankly, neither our attorney nor I can completely remember where it came from, but I know that many years ago, there was an attempt to severely limit the amount that the superintendent could do. And it was down to 7,500 or something. And I believe this came about at that time, but it has the exact opposite effect of what it's intended. This says that the superintendent shall not be required to obtain board approval for a purchase made through a cooperative purchasing program or state purchasing program that satisfies the district's obligation for competing purchase. Nobody knows where that came from. And none of the other districts have it. It's unique to our law firm has never seen it anywhere. And frankly, what could happen under that is they could purchase school buses without telling us. They could purchase fencing without telling us. Now they have told us and they have come to us because everybody knows that this is a fluke in there. And there's no action on this tonight, but I'm going to be proposing that this paragraph be stricken altogether. And I'm also going to be proposing that we increase the amount from 25 to 50 to be more in line with the area districts. But that will come back at a later meeting. I just wanted everyone to have this in their hand for to know what we would be talking about coming down the road.
Why can't we vote on it tonight?
Because it wasn't listed on the agenda as an action item. It was as a discussion only. And that was my fault. I didn't realize I was going to get as far as I did on this. I thought I was just going to be able to hand it out and do that. The second piece, 7I, discussion regarding the process of negotiating real property transactions.
It is an action item. Action.
It's discussion on discussion.
On the,
On the, okay, gotcha.
yeah, on the
We
actual
don't hear it, it's action.
Now, on the 7I, I'm gonna be meeting with the attorney later tonight and some other parties involved in this. As y'all are aware, there are 2 proposals that have been brought to us, one by AEP and one by Claver County regarding the sale of property that KISD owns. We're not sitting on our hands. This is a very involved process. This is public, not public, but it is. It's public, it's school district land, and there are certain procedures that need to take place that a normal sell of my house, sell of my business property don't take into place. Some things have occurred. We are pushing forward to it. I would like to believe that we will have something available for discussion by the September board meeting. You may hear out in the town, either got AEP representatives or you have Claver County representatives that are trying to push this through and apply some pressure, and we just have to be very careful. There are some considerations that we will be discussing at a later date in closed session, which is allowed for real estate transaction because there are some issues that would definitely impact our negotiating position in both of these transactions. So I just wanted to update you and let you know that if somebody out of the public says that we're not doing anything, or that Dr. Pitts is waiting on me. And we're gonna have a discussion later tonight with some things that we've come up with to get a little better game plan involved here. It was just for information only. All right. Item number 8. The board will now enter into closed session in accordance with the Texas Open Meetings Act, Texas Government Code 551.1071, and 551.1074 to deliberate and consider the following. 8A, consider and deliberate regarding personnel matters. 8B, discussion regarding the status of superintendent evaluation. 8C, consider and deliberate with legal counsel regarding legal matters. No action will be taken until we return to open session. We are entering closed session at 7:09 p.m.
No, she's already dropped on my other set.
necessary action on matters which the board may discuss in open session, and upon which action may be taken. We're returning to open session at 7:42 PM. There being no action to be taken, do I hear a motion to adjourn? Motion made by Mr. Garcia. I'll second. Seconded by Mr. Galusing. All those in favor say aye.
Aye.
Motion adjourned, 7:43 PM.
Yay, he got one. Before 8 o'clock.
Yes. Thank you. No, that's good.
I know, I thought so.
We took one over.